Hi, everybody. We're continuing our discussion on the coronavirus or COVID-19 pandemic. The Orange County Economic Recovery Task Force has made recommendations for how we might be able to return to some sense of normalcy. Face masks are being distributed and new testing sites are opening in local hotspots. So what does that mean for you? On this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our local medical professionals, and joining me is Dr. Raul Pino, the health officer for the Florida Department of Health in Orange County. Thanks again for joining us, Dr. Pino.
Absolutely. Thank you for having me.
I know that you have been visiting some of the testing sites around the county. Can you give us an update on the testing efforts?
So the number of testing daily has increased in our county, and some days we are even receiving 1,700 tests back. Many community partners have engaged in testing. You have Advent Health, True Health, you have health services from the county's office, and also our offices are conducting testing, and many other private providers are engaging. So there is an effort to test as many people as possible so they can have that information.
And I know that there are some new testing sites around Orange County. Can you tell us about those?
Yes, and those are one of the ones that I described to you prior. The Orange County government has opened 2 sites. They are moving around the county, and we are collaborating with them. We are using data. So we map our data maybe every other day to see where are those areas in the county that we either having a high incidence of cases or we are not testing enough, and then we move into those areas. I encourage people to do testing. Next week we will do the same. We will be in 5 different locations next week to increase testing around the county. And then you have fixed locations. Again, through health, the health systems and private providers are increasing their testing efforts.
Now, we've seen the swab tests as well as the saliva test, but we're hearing also about the rapid response tests. Can you give us some information about what that is?
So the rapid test is supposed to be done in 15 minutes. It was one of the tests was developed by Able Laboratories, and that's the machine that has been used, I believe, in the White House and other places. There are some issues with testing in general for rapid testing. There are a lot of false negative. So that data needs to be reevaluated. And it's that function of the relaxation of the controls that are in place by the FDA to assure that all these testing and any treatments and any clinical practice elements go right. And because of the pandemic, some of those elements have been relaxed. So it will be normal to have this type of fluctuation on the testing performance.
And as things are starting to open up around Orange County, are you starting to feel as though people are relaxing some of the core things like social distancing and hygiene? What would you tell people to do as things open up?
So I know that we are all anxious to open up, and listen, I'm the person with the highest vested interest in opening and getting over this element that we have been dealing with. But the reality is that if we relax and if we do not adhere to the measures that brought it to this point today where we have a very low prevalence of the disease in our community, we could go back to it. We could go back to higher numbers, and we could go back to even applying some closings if we have to. So it's critical, important to get it right, to solidify our bands, and then to move forward and not to precipitate. So people really need to wash their hands. They have to use face covering. They have to keep social distance when possible, and then prevent this from coming back in the force that we had it before.
Were we starting to see the numbers in Orange County going down?
Yes, the numbers in Orange County has consistently go down for at least 3 weeks.
And again, we always ask who needs to be tested. We have the testing facilities open. The test that I took, there was only one car in front of me, so it was really fast. But who should get tested?
So at this point, anyone and everyone who wants to be tested. Of course, we would like people who have developed any type of symptom be tested rather quick. People who are hospitalized where treatment pathways is determined by the results. Healthcare workers, first responders, those should be tested constantly. But the community at large, we have capacity right now. And as you said, we are seeing a decline of the demand for testing in our sites as well.
We're hearing about a drug called remdesivir that is having some promising results in people who have been diagnosed with COVID-19. Is this too early to talk about how promising it is, or are we seeing some results that we can rely on?
Well, it's an antiviral drug that was developed for HIV by Gilead. And fortunately, they have sufficient in reserve that could be start the process. It is showing some results. It's not clear how much of it is attributed to it because it has been randomized, but it has been used because it's FDA approved and going through all the studies, so the side effects are minimum. But it will be important to see what happened with the drug, how it's used, and what really effects it's having in people. I actually was talking to one of the infectious disease providers this morning in our systems, and they are trying to get their hands on it to be able to test it as well.
As we approach hurricane season here in Central Florida, what advice do you have for shelters, particularly those who are taking in people with special needs?
So those shelters are normally managed by us. So we have to restructure the way that we set up the shelter, and we may even have to have partitions. We normally have an open floor plan, but in this case, I think we may have to do different, at least this year, where we may have to take less individuals and open more shelters instead of just two, so that we have the ability to keep social distancing and protect people, which are the most vulnerable from acquiring the infection as well.
And Dr. Pino, just like me, in January, I understand that you had an illness that you were not probably sure at that point was COVID-19, but what can you tell us about your illness and how you got through that?
Oh, it was awful. So I normally get my flu vaccine every year, and I never had anything like this. And although I know that sometimes, even when you have the flu vaccine, you could get some modified version of the virus, this was bad. This sent me to the hospital. I lost 15 pounds in 10 days. I gained those back already, but I lost 15-pound days, and I was sleeping 14 hours a day. I was done. I went to the ER thinking that I had pneumonia. And although the test was done and there was probably some cross reaction, the x-ray can clear, but I never felt like this. It was really bad.
Wow. As we are moving toward opening up things and people are getting a little frustrated with the social distancing and things like I mentioned before, what advice do you have to people to stay the course so that we can keep the numbers in Orange County going down?
I think that everyone have to think in different ways. The first one is that pandemics and epidemics start with one person. So we all are responsible for keeping this down. This is not something that is, in China. This is not in Africa. This is not in Europe. This is here. And we have the ability. We are the ones who carry the virus around. And when we understand that the virus doesn't move, swim, fly, or crawl, we move it around. That's why the social distancing worked. That's why staying at home orders work, because we were not moving as much. So it's important as we increase, and society have to go back to normal. We need to go back to normal, not only for economic reason, but only for help. But we have to do it in a sensitive way that prevent this from happening. And we have to adapt to this new normal where social distancing, masking your face, washing your hands, cleaning surfaces, and not congregating in groups larger than 10 people is the normal practice until we either get immunity of the herd through natural ways or we get a vaccine for the virus.
Well, Dr. Raul Pino, thank you for being with us today, and thank you for keeping us informed from the front lines of this pandemic and for your work.
Thank you for having me and for giving me the ability to talk to your public.
And we'll be back with more. Stay with us. This outbreak of the coronavirus may be stressful for people, but it is very stressful for business owners who are trying to figure out what protocols to follow so that they can successfully reopen in the future. Joining me is Jerry Ross, the president of the National Entrepreneur Center, and he's here to tell us how his organization can help during these trying times. Good morning, Jerry. Thanks for being with us.
Good morning, Clarence. Thanks for having me.
Tell us about the National Entrepreneur Center and what it does.
Well, the National Entrepreneur Center is a public-private partnership that has been operating in Orlando for 17 years now. It's a group of nonprofit business support organizations. We have 13 of those, all located in one place at Fashion Square Mall, all with a single mission, and that's to help small businesses grow. And so especially during this time of the economic shutdown, those organizations have all worked together to say, how do we equip these businesses that are going through this economic time with information? How do we consolidate that information? And how do we deliver it to folks wherever they are?
And what advice do you have for businesses that are really struggling right now?
Well, first of all, you don't have to do this alone. There is a whole group of organizations, not only at the National Entrepreneur Center, but in our community, that are working together to say, how do we get all of these businesses that are struggling access to the help that they need? And sometimes that's the financial help through the bridge loans that have been offered through the state, through the PPP loans that have been offered federally. And so sometimes it's about how to help those organizations through the application process. But not everyone qualifies for those kinds of loans. And sometimes it's help connecting to local service agencies that can provide training, that can provide, and right now Orange County government is providing free PPE equipment to say, how do we get businesses prepared to reopen? And so for those businesses that are struggling, I would say, first of all, you're not alone. There are lots of people going through what you're going through. But secondly, don't do it alone. You've got to reconnect. And one of the best places to connect is the National Entrepreneur Center at our website, which is nationalec.org. And we have a COVID link right there when you hit it to say, how do you get connected to the resources in the community?
And Jerry, you're on the Orange County Economic Recovery Task Force. Tell us about its role in helping to get businesses reopened here in Orange County.
Well, yes, Mayor Demings has formed a task force to get businesses reopened, and that's been an amazing experience of the true collaboration that happens in this community. Many communities don't have this kind of collaboration. So there's about 44 people that are working together. They've divided those up into separate working groups. I'm particularly working on the working group of business readiness to reopen. And our particular end of the task force has been hearing from experts in fields from not only sanitation and cleaning to prepare a facility to reopen, but also some of the challenges that we're going to face when we do reopen, much like childcare facilities, because with social distancing and with some of the requirements to reopen a childcare business, those are going to limit the capacity of those businesses. And if access to childcare is limited, that means that some people who may be ready to go back to work may not be able to because they don't have access to childcare. And so there are lots of different applications and different challenges that we need to consider, which affect lots of different businesses. So this task force has been an amazing experience of bringing experts together, some of the medical experts to talk about the trends that are happening, but also allowing us to say, what are the best practices to helping getting these businesses reopened again?
And as businesses are starting to think about reopening, information is really key in order to make that happen. And I understand that there is a booklet, a PDF that business owners can access to get information about what they need to do to reopen.
Yes, we have it at the National Entrepreneur Center. We've acted kind of as a consolidator of information because there are a host of organizations out there that say we want to help and we want to get you information, and so you go there and they send you somewhere else. What we've tried to do is to take all the best information that's available and put it together in one place. And so that was our first attempt while people were closing to say, here's where you get access to the resources you need. Now, as people are starting to reopen, we're putting together the best thought process for what a business owner should consider prior to reopening. And we're calling that our Reopen Ready plan. And so that's everything from general common guidelines about social distancing and maybe wearing a face cover when people come back, but also connection and links to resources in the community that can provide you industry-specific best practices. For example, like hair salons, different industry protocols that might be provided by a particular industry, manufacturing possibly. So then we've got a list of things for reopening resources, how to get those, establishing your own internal guidelines for your employees and how to train them, what kind of policies that you might want to put in place. For example, should someone wear a face mask, or are they not going to be asked to wear a face mask? Having sanitizing stations, ongoing considerations about how often you will clean a facility, and maybe even the signage that you might need for directing people who want to engage of what you have done to provide for their safety, but also that what you're asking them to do to provide for the safety of your employees. So all of those things are put together like in one document to say, this is continually going to change based on the best data available, but it's something that can help a business owner think through the process of how they keep their employees safe, but also how they keep their customers safe.
If a business owner were to come to the Entrepreneur Center for help, what are some of the tools that you use or resources that you supply that would give them a path forward during this pandemic?
Well, right now, if they came to the center, it's closed to the public because we're all working remotely. But typically, when someone comes to the center, we have some resources available. We have databases that people can access. But we also have these 13 organizations that all share our center. It's a very unique offering of lots of different resources for help, free coaching, one-on-one coaching. We have low-cost education seminars that mostly over this time have been offered online or virtually. And we are about to launch, I think I'm okay saying this next week, that we're about to launch our online learning platform, which will be the National Entrepreneur Center Online, which is the first time that we've provided access remotely to over 300 learning modules for people that may continue to work from home because either A, they really like it, or B, they may be immune compromised and be choosing to work from home even after some of the businesses reopen.
So how can people contact your office for information and help?
Oh, the best and easiest way is to go online at nationalec.org. We've had about 3,000 people in the last month that have gone through our COVID resources link, but we have over 100,000 followers on Facebook, truly engaged in the conversation about entrepreneurship, and so we need to get our small businesses back open. We need to help them through this process, and that's the mission of the National Entrepreneur Center. So I would encourage them to engage us online at nationalec.org. Next week, they'll be able to engage us in online learning at nationalec.org. And then eventually, hopefully by next month, the facility will be open again to the public and that they could come and visit us.
All right, Jerry, thank you so much for all you're doing in the community and all the Entrepreneur Center does as well. Thanks for being with us.
Thank you. Thank you, Clarence, for giving us the opportunity to get the word out. This is really important as a community to get our businesses back open and our economy back on track.
And stay tuned for more. We'll be right back with more information. While people across the country shelter in place, work from home, or begin to open their businesses, there are many Central Floridians in need of assistance in a variety of ways. One of the main organizations people turn to for help are the numerous agencies that work with United Way. And joining me is Ray Larsen, Heart of Florida United Way's Senior Vice President of Strategic Impact, to explain more. Ray, good morning and thanks for being with us.
Good morning. I'm very happy to be here.
Give us an overview of Heart of Florida United Way.
Well, we like to say that it's our community's United Way. We serve Orange County, of course, as well as Osceola and Seminole County. And we're both a place where people are able to contribute their dollars and have those dollars pooled together. And then that makes it possible for United Way to partner with other nonprofit agencies, to run programs, and to provide direct assistance to those who need it.
And in this time of coronavirus, how are you getting assistance to people in need these days?
Well, you know, our main tool is our 211 Information and Referral Center. And that is a 7-day-a-week, 24-hour-a-day center to which anyone can contact. The easiest way is to simply dial 211 on your phone and be connected with a specialist who can listen to what needs that household is experiencing and then help connect them to the appropriate agencies in our community that might be able to help them.
That's great. And I saw on your website something called the ALICE Recovery Fund. What is ALICE?
Well, ALICE stands for Asset Limited Income Constrained Employed. It's the way that we describe actually just about half of the population in Central Florida. There are people who are working, sometimes more than one job, and are making it, are able to pay for their basic needs and their shelter, but are one emergency away, one challenge away from perhaps they're not being able to pay certain bills, their housing becoming unstable, or not being able to pay a utility. And so when we talk about our ALICE fund, we actually have an ALICE fund throughout the year, and we have an ALICE COVID recovery fund right now to help those families get over that challenge.
And what are some of the other things people need to know about the United Way during these unusual times that we're in right now?
Well, what I'd want to make sure they know, and I'll just mention that all the information I'll share is available on our website, as well as connections that you can just click on. The most powerful tool that we have that can be helpful to people, as I said, is 211. But a lot of people don't realize that you can connect to 211 and to a specialist there in a variety of ways. As I said, it's very simple. You can call by just dialing 211. You can text the center by texting your zip code to 898-211. Or you can go to our website and you can click to either mail or to have a chat with one of the specialists. And what will happen is, and I'll mention that our specialists are highly trained, and they have a very complete database of services and programs. And the specialist will talk with the person contacting the center. As I said, come to understand what their needs are, and through that conversation, identify the best agencies, the best resources in our community to connect them to. I'll also mention on our website, individuals can search that database. It is interactive, can search that database on their own to look for resources they might need. There's also a unique database around COVID information and unique resources around COVID that people can search as well on our website.
So now that we know what United Way can do for us, how can we help the United Way?
Well, I really appreciate that question. And As implicit in our name, the way that United Way helps is by us being united as a community. And certainly our community has a history of coming together when it faces a challenge for the better. You mentioned in the beginning that businesses and nonprofit agencies are starting to come back from working remotely and to open their doors. It's always been important, but it's even more important now. Volunteers are very important. And again, if someone's interested in volunteering, they can go to our website and just go to the button that says Get Involved. And that'll connect them to our Volunteer Resource Center. And there's a database which all the nonprofits in the community kind of keep opportunities to volunteer available there. And people can search that for opportunities to help. I'd also want to mention that, as you mentioned, we have the Alice COVID Recovery Fund. We have a long waiting list. The community has been very generous up to this point, but there's still many more people have need. And there is a donate button now that's on our website that people can make donations to the United Way.
Well, Ray, thank you for all you do, and thank you for the work of the United Way, and especially during these trying times we're in. And thank you for being with us today.
Well, we thank you, and thank you for all the good information that you make possible in our community.
Stay with us. We'll be right back. We've heard from a variety of leaders today trying to keep you informed about different aspects of the coronavirus impact here in Central Florida. From local government, the medical community who is on the front lines dealing with this pandemic, and organizations who continue to serve this community. We're also here to help you keep making those healthy connections. Stay safe.